health service company.
Well, when I agreed to speak here today, I never envisaged that there would be such an exciting, dynamic gathering as we've got here today. So, I'm a GP, I chair East London's local medical committee, and when I look outside the door here, you see the Royal London, the new Royal London Private Finance Initiative building going up. And one thing we didn't expect after the general election, when the government promised that the NHS was safe in their hands, what we didn't expect was that almost immediately, in fact the day that I think the Unison workers here had a rally in the school, that the London Hospital would announce 600 job cuts. That's on a workforce of about 7,000, so that's about 10% cuts, of 200 of which are nurses. So the first lie, that there will be no cuts in NHS frontline services, is clearly nailed. The other thing they promised us, the government, when they were elected, was that there would be no structural reorganising of the NHS. And as soon as that promise was written on the paper, out comes their white paper called Liberating the NHS. Now you could call that eviscerating the NHS or privatising the NHS, because 366 pages of parliamentary gobbledygook revolves around handing over £80 billion of NHS funding to various GP consortia, which we're being forced to start setting up now. That means that the 150 primary care trusts up and down the country are being scrapped, and all that budget is being put in the hands of GP committees. Now, GPs don't have the time, the knowledge, or many of us the inclination to handle that kind of budget. So, waiting in the wings, we have a whole bunch of private companies wanting to offer their services. They're busy recruiting NHS managers as we speak. United Health is one of their names, McKinsey, a large American company, is another of their names, and already in Hounslow, the GP consortium there are farming out their management services to a large American healthcare company to do that. So that's the first thing, that the commissioning of healthcare is being privatised. And then you go to the hospitals themselves, the actual people who are providing the services, and what do you find? That NHS hospitals are now being forced to call themselves foundation trusts, just like schools are being forced to become academy schools. And in competition with them, the new legislation will say that any willing provider, any new private hospital, any new private community organisation can compete to provide NHS services with NHS money in competition with NHS services. Now, when this started, first of all, with the casualisation of cleaning in hospitals, what did we notice? But hospitals started getting dirtier and dirtier, more and more infections, more and more people dying. I'm sure it's the same in council services and in schools as well. Now, if this wasn't bad enough, this is occurring on the background of 4% efficiency savings, so-called efficiency savings that are being made every year. Now, the last time that the Tories were in power, we had 2% efficiency savings, so 4% has never been achieved anywhere. And it is a complete lie to say that those cuts will be made without there being major cuts in frontline services. Which brings me on to the next point, that when you go to the marketplace, and this legislation is about bringing the market into healthcare, and you want to buy a cauliflower, and you find that it's a bit rotten in the middle, it doesn't matter. You've only wasted 20 pence on a cauliflower. But healthcare should not be like that. If we have the race to the bottom with providing NHS services at the cheapest price, quality will suffer, and when that happens in healthcare, patients die. So what we're facing now is the first year of 4 years of painful cuts. So health workers will soon, I'm sure, be joining you. Now tonight we are trying to follow up what John McLaughlin said about the £10 note outside Deutsche Bank. We're having a march at 5 o'clock from the London Hospital, marching directly on Deutsche Bank, and we're hoping... We are going to deliver a statement to Deutsche Bank demanding that the bankers there should hand over their bonuses to the cancer ward at Barts. if you're not too exhausted by the marches and the protests that you've done today, as many of you as possible be welcome on the steps of the London Hospital at 5 o'clock tonight to join us. Thank you very much.